Welcome back. We're on part 2 now of our Trach talk, and yeah, take it away. We're going to be talking about what we're talking about today.
We are going to talk about vents because there are multiple home vents that kiddos can go home with, and we have brought back lovely Mary Ellis here today because
Yes. Hello, Mary Ellis.
Hi guys. Thank you for having me.
of course, because my daughter Grace is on the LTV 1150 vent and her daughter is on the Trilogy, so I thought it would be good to at least have a different perspective. And I do know there is one other vent out there, which is the Astral. That is another vent. Yeah. And actually Grace is potentially going to be trialing that next week when she goes in.
Nice.
So
when we're talking about vents,
now,
what part is that again?
So
I think there's a bit of delay in the video, isn't there, at the moment?
Yeah, we can take a second to make sure that we have from the delay. So this is the vent.
So the machine, the whole thing, okay.
Yep.
Just because some people watching might not know yet, or I just thought I'd ask because I wasn't sure what you're talking. Yeah. I thought it was the plastic bit, but go on. I'm just going to sit and listen.
Everything has. No. We want you to ask questions, Larry. It's good to ask questions because it's true. You know, even before the trach, I didn't know that there was. Everything seems to have a name. You know, of course, everything has a name, but when they talk about the vent, they talk about the actual piece of equipment. And then the vent, of course, has pieces that branch off of it, which is, you know, the tubing, and then you have the humidifier, and then you have the filters. So then there's other things that attach to the vent, you know. So yes, the vent is the actual
vent is the
piece itself. Yeah.
Okay.
And then if there's something that comes up, like when we talk about circuits and stuff like that, we'll just remind us that I'm not a trach baby. I don't know what that means. I don't know what circuits mean. I don't know what
yeah,
you know,
I will.
I don't know what an HME means, and then, you know, Dee and me will do our best to kind of throw the information out there.
That's right.
Thank you.
That's right. So this is actually Grace's travel vent. This is the one that is not stationary in the house. It has this carrying case over it, and then it has these extra batteries that are attached to it. So that way we can have as much power when we go out and travel with her. And as we were kind of talking about, this is the tubing that connects to her trach. So she's her extension, and these are actually travel tubing specifically because
I was going to ask you. Yeah, because this one looks different than ours. Yeah. Now, with yours, because when we have the travel one for us too, the tubing looks different. It's just one straight circuit, but I see that your circuit kind of branches off for the travel. What is that for? Yeah,
so I'm guessing the way that the vents were made, it's always has one. There's two tubing for some reason with this one, and on the very end, it's like the open-ended outlet here that the air goes through.
Okay.
On this one.
Okay.
And then on the
other. Is
other,
that also like a filter?
I actually have no idea why it has two. That's real 101. I have no clue.
That's good. No, that's right. We got to be completely honest with these people because there is a lot of things that are attached to them that we just don't understand for what reason. Like I've done my best to try to understand the settings. I'm better with the pieces that are attached to the vent, and I know what they are for, you know, escalation valves and all this other stuff. But like the settings are a little confusing. So yeah. Go ahead, I'm sorry.
And the other part goes right here. So then this basically connects to actually the air that's coming out, and then she has her bacteria filter connects right in here.
Yes.
Yep.
Is that
Very
heavy?
nice.
This thing is ridiculously heavy. Holy moly. It is
Really?
this. Okay. So this vent without the batteries is 16 pounds. Okay.
Okay.
Add these 2 batteries, you're talking about now it's about 25 pounds. Yeah.
Oh
Nice.
my goodness.
How do you carry it then?
Now the
Just
battery
by the
life
handle?
on
Or?
that one, how long is that? Oh, sorry. Go ahead.
It's okay. I'm done. That's what I wanted to know. Like, because we've got the suction, but obviously that's quite bulky as well. But it's kind of got the, strap, so you
The
can
strap.
kind of hold it.
Yeah.
Mm-hmm.
I
The
just,
straps help, thank God.
I just thought that looks quite big.
It is.
Not the best thing to carry around.
Yeah, it's a little bit of a beast. It's it'll last about, I think, 4 hours, 4.5 to
That's
5 hours
Okay.
on the battery. So we
Yeah,
Quite good.
that's
travel
That's
with
quite
the
good.
car charger.
Hold on a second.
yeah,
There you
that's
go.
like ours too. Ours has the 4-hour battery life. And then, of course, we can charge it when we're in an appointment, just plug it into the wall, and then it just kind of recharges.
Mhm.
Do your batteries come off?
They do. They can. They can come off, and the internal life, I believe, is like 45 minutes without it being like plugged in. It's
Really?
not very long at all, from my
Okay.
understanding. Now, if that's changed or I read it incorrectly, but every time we've had a couple incidents where the power's gone off and it goes into its like backup mode.
Okay.
It kind of extends the life of that internal battery. So we always have it plugged in no matter what.
Yeah, that's good. That's good.
But what's interesting
Now,
is,
does it go?
oh no, go ahead.
No, I was gonna say, I mean, it goes off and it tells you the sounds and the alarms go off when it's on the backup battery, correct? Yeah.
Yeah, correct. And then and which I'll like to see, on Marilyn's vent is, you've got the heater pot that you've got back there. So we talked about the HMAs last week. So this one,
Yes.
this would make like the heater pot, and we just connect it right in here. So when we're traveling, she can have her humidified air. So we just connect it right in line.
Okay. Very nice.
Because the other circuits that are inside, one is white and one is blue, and it's coiled so that it can get heated. So
Yes.
different.
Nice.
Yeah. But here, I'll turn it on and so you guys can kind of see what it looks like on.
Oh, yeah, it's loud.
So, yep.
Oh,
This is.
I see the settings on there. Nice.
Yeah. So I've got my hand over it so that it won't alarm.
Yeah.
Oh,
I should know what I do.
I was going to say
have-
the point of
I
the
put a little
machine
long on
is. I was just going to say the point of the machine is for the pressure, isn't it?
Yes.
Yeah. Okay.
I'm going to turn it off because then I can't hear you guys.
Oh.
No, I was just saying because I think because you two are very a lot more experienced with these machines, I just noticed that there's a few simple things that we're missing out. Like, I still didn't know the exact reason for the machine, what it is like.
Everybody has.
It's the pressure, isn't
Everybody
it?
has everybody has their, I guess, their reasons. I know that Dee has her reasons, and with Erilyn, and this is kind of going back to like the history of Erilyn and her respiratory issues.
Yeah.
The reason why we've gotten to this point has been there's been many years of trying to give her the support that she needs, and we started off. I mean, she's always been when she started off on room air, and only needed the assistance of CPAP at night. And then from there progressed, and it went from her being on a CPAP during the day and the BiPAP at night. on a face mask. So she had this little cute face mask that would cover her nose, and then that would blow the air. And the reason why we ended up putting her on CPAP to begin with was because when they did a sleep study on her and realized that she wasn't getting enough air in, she was having apnea, obstructed apnea. So that's why to begin with, the CPAP started. We started off with the CPAP. It was only at night because the studies were showing that she wasn't getting enough pressure at night. And then eventually with her growing and doing more sleep studies, we realized that she wasn't getting some of the pressures during the day as well. So we started putting her on the CPAP during the day and then give her more support with the BiPAP at night. And illness plays a big part of why these kids are, I mean, for Erin at least, illness plays a big part of why she's on the vent. Because when she does get sick, that's when we need the support from the vent. Because Erin, I don't know if Darcy has low hypotonia, like low muscle tone. But Erin has a combination of low muscle tone, and she also has the obstruction of the cleft lip and palate. So all those little things play a part of why Erin is on a vent. And then, of course, 2018, we got hit pretty hard with an illness, and she had both lungs collapse, and then we couldn't recover well enough, and that's why we opted to
Wow,
do
that's a traumatic event to happen.
Yeah.
Such a little person.
Yeah, it was a tough situation because you know, we were doing pretty well. Like I said, we were on room air for most of the time, and she was on her vents at night, and going back and forth with pulmonary. Pulmonary is the one that leads the way when it comes to all these decision making, when it comes to respiratory stuff, and they give us their input with tests, of course, because we have to do sleep studies, and that's why we're constantly in the hospital doing testing and sleep studies and EEGs and all this stuff, just to kind of get a good understanding of where Erin is with her health. And so when she did have that issue where both lungs collapsed, she was completely debilitated, and they were giving her the max support in the hospital. She was on I can't sit here and tell you exactly what type of pressures she was on, but she was on pretty high pressures, because anytime that we talk about that event and a respiratory therapist looks at her history and her chart, they kind of gasp. They kind of gasp at the settings that she was on. And so their reaction, they're kind of, let me know that, yeah, she was on some serious stuff before we were traced. So.
Wow.
Yeah.
So yes,
the hospital vent at that point when that had happened, they moved her from her home vent to hospital vent.
Yes, exactly. So usually when we go into ICU, they use the Trilogy 100 at the ICU. So that's why the first vent that they gave us for Erin, they prescribed for Erin, was that one, because it was easier for her to go into the hospital, because those are the type of vents they use at the hospital, at least in my hospital. And so, that was the situation. She was on her home vent. She couldn't get enough pressure on her home vent. And so at the hospital, they have all these updated and more pressurized equipment. And so they had to put her on the max on some crazy equipment there. I have pictures on the Instagram account. If you guys scroll down back to 2018, you'll see that she had a full face mask. It was covering her eyes and her mouth and her nose, because it was trying to push in as much pressure as possible. And we couldn't get her to bounce back quick enough. So that's the reason why we went for the trach. And
she had to have that on the whole time, the face mask.
Yeah, it was tough. It was a horrible hospital admission. It was a really tough one, because we started off with the nasal one, the one that covers the nose.
Yeah.
That wasn't giving her enough pressure, so then they moved up to a bigger mask where it covered her nose and her mouth. We kept trying to, have it sit right and give her enough pressure, but then we would have leaks And she would have breakdown on her nose because it was so much. It had to be tight enough to blow all that pressure into her little lungs. So that wasn't working, and then they moved her up to the full face mask.
It looks like
She looked like an astronaut,
right?
and she was like that for a few weeks. And it was so
Wow.
hard because Erilyn, for the most part, she was doing very well. She was tolerating it, but then like a couple of weeks into it, you can see her like with her little fingers. I've never seen her do that before. She was actually trying to take it off her face. She would get her fingers into the side of the mask, and with her hand, she was pulling it off. And that was heartbreaking because, you know, to try to get her to do something and then for her on her own to fight and say, no, I don't want this on my face was hard. And then we had the conversation of the trach, and the specialists and doctors all, you know, sat me down and they said, listen, this is a situation now. We know that her baseline was good before this. We know that she could be on room air if she needs to. But for now, this seems to be the direction that we need to move on. And we have to make a decision, you know, we have to get this kid well. And the trach is not permanent, because that's another thing. People feel that the trach is permanent. You can, you know, you can do well, and then they'll cannulate you. They'll do the surgery to close it up. And then you can go back to, you know, to your baseline. But for now, for us, especially for me, I said, if I'm going to put her through a surgery like that, I most likely would probably keep it for a while. You know what I mean? We'll keep her for a while, because when illness with Erilyn, it's always a hit or miss, you know, and at that time it was a real hit. So
I want to go
So
back
we went-
to a point real quickly and explain to Larry, because
Yeah.
you talked about the face
Yeah.
mask being around her, and you talked about
Yeah.
a leak. I think it's
Yeah.
important for parents to know when we say,
Yeah.
oh, there's a leak. I mean, it seems pretty explanatory, but it's typically when air is
No,
escaping. So,
escaping, yeah. Yeah, so they're not getting the full pressures that they need, you know. So
Yeah.
we kind of deal with that now as well with the trach and the stoma being so wide. Sometimes we have to cough our kids in order for us to get that pressure that you know they have the settings for, you know.
So having a
And
mask would be a bit like blowing up a balloon, really, wouldn't it?
exactly, yeah.
Yeah.
So you want her to get the right amount of pressure, because everything is calculated. You know, everything is so, you
Yeah.
know, we have numbers for everything. There are numbers for the amount of pressure that she's getting and the amount of pressure that is escaping. You know, everything has a name for it, the PIP and the IP and all sort of stuff. So, you know, everything is so calculated, and that it needs to be, if there's air escaping, then there's no point of it. You know what I mean? Like she's not getting what she needs. So that's why we monitor every little number, every component to the vent. Want to make sure that everything is correct in order for them to receive the pressures and the air that they need. So
exactly.
yeah, when we're talking about the leak, that's when air was coming out and she wasn't getting the sufficient pressure. So yeah.
So one of the other things too, I think, is you know, with vents, is it can tell you your respiratory rates. So that is something else. At least on our vent, we monitor her respiratory rates. So how many breaths she's taking per minute. You know, we can monitor if she's breathing too fast. That could be a problem. You know, it's not her baseline. So that's an indicator that is something's wrong, or you know, maybe she needs suctioning, or you know, maybe her cuff or her trach is, you know, kind of in the wrong angle. So respiratory rate is definitely something that we look at as well.
And you guys have got different vents, haven't you? You've got two different.
Yeah.
Are they
we have different vents, but they're kind of. Go ahead. I'm sorry.
No, I was just going to say, do they do different things, or are they just different makes?
Well, I think they
thing.
do, everything does the same thing. Yeah.
Yeah.
Just kind of like feeding pumps, like the Infinity and the Kangaroo pump. They're all designed to do the same thing.
Yeah.
But they're just different brands. And I don't know why. I guess some places, depending on your location or depending on the hospital or depending on the DME company, whoever's closest to you, the respiratory therapist is the one that decides what type of vent, would work. But they're all kind of designed the same way, where they're, they all tell you the same type of alarms, and they're built for that reason, for them to give the child or the patient the pressures that they need, to help them in their respiratory journey, I
they
guess.
usually have multiple different settings that they can handle depending on like the kids. As she mentioned, CPAP, BiPAP. Grace is on one called SIMV mode. So there's, quite a few. And then there's like other combinations that I really won't explain because I probably won't explain it very well.
AVAPs, and ST. Yeah, ST and the AVAPs, like Erin is on ST mode, and there's a bunch of modes and stuff like that. And like I said, when it comes to the technical part of it, a respiratory therapist would be the one who can give you more or less the reasons why, and explain it better than I can, at least. But for us, we work on the settings all the time. We're right now with the respiratory, with the pulmonary doctor, I should say. We're trialing some settings right now. She's on the ST AVAPs with her cough up, and we're going to try that for a little while to see how she's tolerating it, because recently we've had some issues where we started seeing some alarms and some issues here and there, and so we're trying to get her to a new baseline, and then try to work her back to her old baseline, which was room air and stuff like that. She also has settings for sick protocol, so if she does get sick, those sick protocols are on a higher level of settings, so those are giving you more support.
So you're allowed to actually change your vent settings for a sick protocol if you have approval?
Yes. So the pulmonary doctor writes out, for my nurses at least, they write out the 2 settings, and they write out protocols. So we have what's called the sick protocol that we can go to whenever we feel like Erin is showing signs of illness. So if her heart rate is going up, if we're getting a lot of secretions, if we have to suction, if the colors of the secretions are not looking well, if she's having a temp, then we start realizing, okay, you know what, let's move up to our sick protocol. And we have the right to do that, because we have the script, and my nurses are allowed to do that. If we have to pass the sick protocol, then most likely we're in the hospital at that point. If we see that she's needing more assistance than the sick protocol allows us, then we have to take her to a hospital and have her evaluated. And then at the hospital, they have to get her either back to her baseline or back to a sick protocol where we can handle here at home. And so, it's good. At least we have some room to move around with settings and stuff like that. Because I know a lot of some parents, or at least in my understanding, you're not allowed to touch the vent or change the settings because we're not respiratory therapists.
Yeah, they allow us at our hospital to do anything but her regular settings. They won't write sick protocols for us. So we have.
Oh, they won't. Wow.
Yeah, we have to have the prescription come in for any changes, and then we have to call the DME to come out if we wanted to.
Oh yeah, we have that too. Yeah.
But they won't even have a sick. We have a sick protocol on what we do in order to help her, give her more support. But yeah, at that point, then we would be going back into the emergency department. So
yeah. So that might be the difference with, I don't know if that's the vent, because our vent has actually a selection. So we have our primary settings, and then we have our secondary settings. So we're allowed to switch back and forth to our primary and then our secondary settings if we need to. As of putting numbers in and stuff and telling the machine what we want, we're not allowed to do that. It would have to be through the respiratory therapist, because we have a respiratory therapist that comes to the house, takes down vent setting information, and then sends it back to our pulmonary doctor. And then they record more or less how she's been doing on the vent. But for us to touch it and change numbers and stuff, we're not allowed to do that. And switch back and forth, if that makes sense.
Yes, yes, and it could
Yeah.
be the vent.
Larry's probably like, what does that mean?
No, I'm keeping up. I'm
You guys
keeping up.
lost me a long time ago.
No, I'm still here. I'm keeping up with it.
Can you show us Erilyn's vent so they
Yeah.
can see the difference of the trilogy versus?
Yeah, absolutely. So this here, I'm going to turn it on. I don't know if you could see it because I'm on my phone, so I can only see. So this is her trilogy. It's a trilogy 100. I know there's a few models of the trilogy, but we have the 100. And then at the top here, if you look at the screen, there's it tells you the pressure, the respiratory rate, the VTE, the leak, the PIP. And so all the numbers are displayed on the front screen here. If my nurses need to look at anything, or if they need to jot anything down, they can hit the menu button and then
So they're
navigate through the settings.
quite a serious bit of kit, really, aren't they? There's a lot going on.
Yeah, it definitely is. It's it's loading equipment, so this stuff is serious.
Yeah.
There's and that's why that's why they're not that's why they don't give your kid to you and we're like, here, go home with her. We're like, here, you need to learn this, and we need to test you, and you need to be tested. And so that happened with us, and I'm sure it happened with you too, Dee, when once Grace was trait, or Erilyn is trait, it was a whole new world. We were sent to a rehabilitation center, and at the rehabilitation center, we had a respiratory therapist walk us through all the different settings and the maintenance of it too. There's maintenance that comes with this type of equipment, and because it's so sensitive, it's going right into the lungs. There's a level of sanitation and like sterilization, that things have to be sterile, things have to be clean, filters have to be clean. So that stuff is scary. We had a crash course we had a 3-week crash course, my husband and I, and at one point, once because you have to learn the dressings and the way that things are. My husband and I, we were given a crash course where we had the respiratory therapist come in and start screaming at us. Her numbers, mind you, she's fine, but they're like, her numbers are dropping. She's down to, her O2 stats are down to 24. What do you do? And then you're sitting there panicking. You're like, oh my God. And then you have the respiratory therapist like yelling at you like a drill sergeant, like, her number, what's the first thing you're going to do, Mom? What's the first thing you're going to do? And me and my husband are trying to remember all the stuff that they're teaching us while we're there, and to try to perform on an Erilyn on a fake emergency scenario setting. And that stuff was, that it scared us into understanding how serious it is.
I'm freaking out if
I remember
were screaming at us like that. I'm like, you realize, this is not my medical profession. I did not go into this as a job. So yeah, thankfully our RTs were very, very nice.
Darcy came to join us.
No, they were nice. No, they were really nice. But I purposely said to them, I said, listen, because they were super nice. But I told them, I said, listen, I need you guys to treat us like this is an emergency situation, because my husband, I love him to death, but he needs an awakening of how serious certain things are.
Mm-hmm.
He relies too much on me to do things. So I had the respiratory therapist, come in like, because he's in law enforcement, so that's what they do, Yeah. So that's the type of way that he's gonna learn. So that's how they came in. They came in just drilling us, and that's how I saw my husband's demeanor change with the seriousness and him being more hands-on and stuff like that. 'Cause every parent learns differently. I'm a visual person, I like learning visually. I don't like the whole, here's a textbook and read all these pages and here's all the information. I can't do that. When it comes to information and stuff like that, I can't. I take it better when it's shown to me, like, here, this
Yeah,
is
I'm
what you
definitely
learn.
visual, hands-on. Like,
Yeah, I'm totally the same.
let me touch this stuff. What does this mean?
Oh, that's neat.
Like, get on there. I know.
Yeah, she came to say hi.
Distraction.
Hey.
She's the best distraction.
She came to join us for a minute.
Oh my gosh, that
Yeah.
face.
Yeah, I mean, these events, Larry, there's a lot of information, and we in 30 minutes you can't even scratch the surface, you know, like what we want to
Yeah,
talk, like, because there's so much going on, and there's there's so much information and reasons why things are, you know, why this is the way it is, and why we have the supplies that go with it, and what each
yeah,
piece does here. If you look at this, you know, here's the filter that we change weekly, and then this tubing goes to the humidifier here, and then the circuit has a coil in it which heats up, and then what is that for? You know, there's so much going on, and there's also the supplies that go with it. We have the HMEs. I have two different kinds of HMEs. One that goes on the dry circuit, and then one that she just has on with a little port where you could put the oxygen on if you need to. And so
I find
yeah,
the
I
amount
mean,
of I find the amount of equipment fascinating.
Mhm. Yeah, there's a
yeah,
lot.
no, I mean, not for nothing. I really, once I understand it, I enjoy it. Because at the beginning, when I first received all this stuff home, I was terrified. I'm like, oh my God, I'm going to make a mistake. And then God forbid, and then all this other stuff. And so you have a lot of pressure as a parent to learn what everything is.
I mean,
Once I got
the
over
room
that
looks
hump,
like a hospital, pretty much. It's very
yeah, oh yeah,
so much.
it definitely does. Once you get over that hump and you understand things, then it becomes, at least for me, it becomes fun. I'm like, I got all this, you know, I got all this equipment, I got all the supplies and stuff like that, and it's fun to put things together. A lot of this stuff feels like Lego pieces.
Oh
You know,
yeah.
you put a
I
tubing
mean,
here, tubing there,
the
connectors
knowledge that
here.
you learn from it, makes
Won't be a second.
it makes you appreciate all of the experience that your doctors, your respiratory therapists go through, and everything that they've learned, and the fact that they're educating you on is huge. So yeah, I mean, we have to
Absolutely.
do cleaning, cleaning her vent once a week, changing circuits. You have to, make sure stuff doesn't get nasty secretions all over it, and you've got to use like
Exactly.
sterile water, saline, all of these different techniques in order to keep your equipment from potentially growing bacteria and nastiness that would travel into your
Exactly.
child's lungs. So very,
Yeah.
very
It
important.
It definitely is. I mean, even with as much as we clean and we sterilize and stuff like that, Erlen still ends up having like tracheal bacteria grow, and then we have to deal with it with antibiotics. And I have a team of nurses that are constantly cleaning and sterilizing, and we can't avoid it. So that tells you how sensitive our system, our respiratory system is. That this is why things have to be a certain way, because I can't imagine an event that's sitting there for a month without equipment being clean or changed, how gross it would look,
Yeah.
how unsanitary and how bad that would be for a respiratory system. So
And I think
I,
it also points out to why parents who have like trait kids are probably more sensitive about respiratory illnesses, because they have this
thank you. Yes.
direct exposure, to, pretty much infiltrate their child's lungs and to make them very, very sick. And so, for a trach parent, you don't want any respiratory illnesses, the flu, any kind of other issues or colds or viruses, are can be very dangerous. And now we have COVID. It's,
Definitely.
definitely something
It's
that
crazy.
we don't like to think about. So
Yeah, we're non-stop trying to avoid that one, COVID. It's a big worry for us at the moment.
It's hard, man. It's hard. All these illnesses, I mean, even before Erlen was trached, how bad these illness can affect the child and debilitate our kiddos, I'm sure, Larry, you've had some moments where Darcy's been very gunky or, congested because of a respiratory illness. Our kids, unfortunately, get hit hard. And so, yeah,
I'll be right back. I've just got to suction her. So
talking about suction.
yeah, last week I had an old trach out that we had that we're no longer using. So I was showing them how, and I have it actually right here still. So for Grace, and I was telling them how our hospital does clean suction. So we don't have the direct inline that's attached to her. They just don't use that. So of course we don't use that at home. So very, very, very different, And again, depends on.
Oh, so you're saying that you guys don't have the inline, meaning, hold on one second. Let me see if I can pull it up. So you guys don't have the inline, the one that, I can't even, hold on one second. I'm sorry, dude. So yeah, I mean, some of this stuff, like the inlines, we were told from, DME companies that we weren't going to get it approved because of insurance, because that's another thing, is that certain pieces and equipment don't get approved, so that we don't have them. But we've been lucky enough to, so is this the inline you're talking about, Dee?
Yep.
Hey.
Hey, Erlen.
Hi.
Hey,
hi, guys.
Oh, look at her.
So she's on her travel vet now.
Nice.
And she has an HME going on here, and then we got her inline. So if we need to suction her, we just go straight in, and it's not exposed, which is great. Yeah, so it stays sterile, and this way we don't have to. At least with that, we don't have to constantly clean the catheters and whatnot. Yeah, because that's what my nurse is telling me about the the contamination and stuff like that of these catheters. Because once you get it contaminated, then forget about it. You get it straight to your lungs, because it bypasses everything and it's direct, So
it goes in the trash.
We've been fortunate because we were having a little bit of an issue with that too. They were saying that they wouldn't cover it, the insurance wouldn't cover it. And then, of course, I had to fight, and then we got boxes of it. So we use that.
Yeah,
I guess they realized that
we were at used it, but our hospital does not. So we have to be extra careful for suctioning.
Yes. Yeah.
But
definitely.
you know what? It hits something, it touches something, it's bye-bye in the trash. A lot of stuff goes in the trash.
That's right. That's right. It's true. I mean, with us too, another reason why we have to keep everything sterile, so we have to throw things out. It hurts my heart because of the earth and so much plastic that we get rid of. Like, we get rid of so much garbage in this house with Erlen, that sometimes I say, if the ozone layer has a hole, it's because of me. Because of all the plastics and the garbage that we have to throw out. We do our best to recycle. But in order for you to keep things sterile, you have to throw it out and just open up a new packet.
Yep.
Because like you said, if it touches anything and then it goes straight into her lungs, you're exposing her to whatever, germs or, are being carried through the air. And
that's right.
So
I think waste. I was going to say, I think waste is a real issue, isn't it? I have the same thoughts with Darcy's feeding and that. All the plastic bottles we throw away, and syringes and things, and NG tubes, and
Mm-hmm.
So the amount of stuff us parents get through with our children.
Yes.
I feel like a right
Yeah.
what's the word? Well, like we're helping the ozone layer hole get worse.
I know they should have
That's how I feel.
kind of like plastic
Yeah.
medical equipment recycle program for parents. I mean, there's
They
got to be.
Yeah, they
right?
should do that.
Huh.
They
Not
should
yet.
have something like that. That would be great because like I said, it hurts me. It hurts my heart to throw out the amount of trash and plastics that we get.
Yeah.
You know, every day we're constantly ripping open a new packet
Mhm.
for, like you said, either for an HME or for anything. Or, you know, you're ripping stuff open, and then once it's exposed, you got to get rid of it. You know, like this stuff here. These HMEs, I just used them today, but I already opened it. She already used it maybe once or twice, and now we got to get rid of it. And this is hard plastic.
Mhm.
You know what I mean? I do my best to put them in the recycling, but how much, you know, recycling, how much can this be recycled down to, you know?
Yep. And
So,
it's tubing too, you know, all of
that's
those.
tubing, exactly, all of that. That's a lot of plastic. That's a lot of waste. And it hurts my heart that that's how it is. And especially in the hospitals, like that was another eye-opening thing as a special needs parent, is going to a hospital setting and then realizing that, you know, once you leave the room, all the stuff that was in that room gets thrown out. So, you know, that includes scissors and plastics and bamboo bags, all the stuff that, you know, that's in that room gets taken out, gets totally sterile and it gets thrown out. And if you use it once, doesn't matter. You know, they can't use it for the next patient in the
Nope.
hospital. So this is why I have these, because I have a respiratory therapist that comes to the house and he's like, "How'd you get those lungs?" And I was like, "I took them from the hospital."
You're like, I paid for it anyway, so I'm gonna take it home. Like it's part of my
That's what
bill.
I'm
So
saying. You know, it's a little I can't sit here and say it's 5 finger discount because my insurance paid for it. So yeah, and so and I pay my insurance. So these things, you know, and it helps because it helps keep the machine quiet and still on. But all that stuff, all that waste, and you know, sorry to, you know, change the subject, but it's just part of the respiratory life as well, and all the feeding life, like Larry said. You know, you get all these bags of feeding bags, and you can only use them for a certain amount of time before you have to dump them.
Yep.
And
Yeah.
so,
Well, they say to us with the bottles that we have, that we, you know, once they're open, we're meant to throw them away. But
yeah,
it'd be a real waste because, you know, one feed doesn't, maybe we'd use half a bottle.
Right.
And they're still
yes.
okay for the next feed. So we wait and use it and do it like that. But yeah, you're meant to actually throw them. We should be throwing away a lot more than we do, and it's really wasteful.
Yeah, we try not to waste as much as we can, but you know,
yeah,
if it did get contaminated, it has to go. You know, but if
oh,
not,
totally,
yeah, yeah, definitely.
clean stuff as much
especially
as
when
If
you're
it could
dealing with the
avoid
lungs.
Mm-hmm.
Yes.
Yeah.
Yes. Anytime you're dealing with the lungs, that gets a little is hard because, like I said, I mean, these kids get so sick, and you're looking at least for me, I've been in the hospital. I'm traumatized from being in the hospital for the amount of time that I've been in there. You know, isolated with Erin in ICU. I thank God for the team that I have at the hospital, and that we've been able to go to the same hospital since she was born, because they at least make it feel like home. And you know, you begin to build relationships with people, and you bond with people, and then the same people see Erlen grow up. So there's a level of compassion there that is necessary for us special needs parents, because when you have a doctor or a nurse that's seen your child grow, and they love your child, and they want, you know, they want the best, they'll work a little harder. You know what I mean? So.
So true.
So I'm trying my best to stay on listening, but Darcy's grinding her teeth like crazy in the background here. That's all I can hear is this squeaking.
That's okay. Well, I think we should
very off-putting.
Erlen, Erilyn's been grinding too. I mean, she's always been a grinder. I don't know if does Grace grind her teeth?
Yeah, she does. And she's teething right now. Yesterday, she had a horrible day. She's getting a molar in. It was awful, but she's
Ah,
like fully grinding and drooling. Today, hopefully, seems better. So, looking on the bright side of that. Man, we might have to have a
that
third
sounds good.
trait conversation now that I think about it.
Yeah, third one.
Yeah,
A third one's fine.
you know what? I'll do a better job next time that we talk about this stuff, and I'll have some stuff written out for you guys and some information.
No, this is
Just
really
because there is a lot. There's a lot of stuff, and
you
for
know,
new parents,
you think about a subject and you're like, okay, yeah, you talk about this piece and you talk about this piece and you're like, oh, wait a minute, I forgot about that other stuff too. That's just how it is. So
Story of my life, that.
there's an immense amount of information when it comes to this stuff, and you know, we don't want to lose Larry either, because there's a lot of medical jargon that comes with the the traits and the vents and stuff like that, and poor Larry's gonna end up falling asleep on us. But
Hey,
but what I'll do is,
I think a lot of us parents experience different parts, you know, like with Darcy, for example. I've had a lot to do with like breath holds and things, and you guys have had a lot to do with the tracks, and it's just these children, isn't it? They're very unpredictable, and each one comes with their own sort of set of problems, I guess you could say.
Yep.
That we
no, but
kind of
that's
try
why
and
it's
master.
important. That's
Go on,
why
sorry.
I appreciate you guys, what you guys are doing, because you're like I said before, we're all having a conversation, and that's what it is a conversation, because we all experience something very, you know, we have the same diagnosis but experiencing it differently.
Yeah.
And I mean, you know, and even though our children might have traits, and then there's still a lot of common ground, and then there's some things that are new. And so the conversation, have an open conversation with you guys, really puts things in perspective. And then I learn about your experiences, and a lot of other parents that are out there kind of with their hands in the air, like, what do I do? What is this?
exactly.
Yeah.
To kind of get a glimpse of what we're doing, you know?
All different.
So,
Well, me and Beck
yeah.
were talking earlier, actually, and we were saying we would have found it really useful when we found out that Darcy had trisomy 13. We would have found it really useful to have podcasts and things that we could have listened to at the time. So I'm hoping that
Yes.
that's how we're helping others, you know.
Same here.
Yeah.
Yeah, I definitely think so. I definitely think so. And even myself, I'm a 6-year veteran, you know, in here with Erilyn. I learn a lot, and I'm learning a lot from you guys, and I'm learning a lot from the other parents that have that are going through it. You know, we have a lot of, I follow a lot of Trisomy 13 kiddos on our Instagram and stuff like that. And, you know, you see everybody goes through their ups and downs. You have some kiddos that are going through their downs right now. And so it's hard. And we're
I
here for
stalk
each
a
other.
lot of people, so when I'm not asking questions, I'm probably looking through past feeds of people who have asked questions in the past and looking at what those answers are, because a lot of the times these questions have been asked and the information's there. It's just, you know, got to search for it sometimes.
That's true.
So
Probably 6 years. That's a long time. That's when you know, like someone that's just got that diagnosis, that's it. That seems so far away. You know, you need to have that whole 1,000-yard stare thing going on now. And you know, if you're a veteran, you've earned that title of veteran.
this is what I get. She gets the clap.
Yes.
Clapping hands.
Yes.
I get the little pat on the back.
Definitely.
You're doing good. Pat on the back.
That's right.
No, but you know, it's funny because I say 6 years, but it doesn't feel like 6 years. You know, there's times that it feels like only 2 years. It feels like I'm there along with you guys. You know what I mean? And then other times it's like, oh wow, 6 years. You know, and in March, Erilyn's going to turn 7, so that's huge in our Trisomy 13 community. And so I'm just very blessed and that we're still going. You know what I mean? And you guys are gonna get there, and you know, it's gonna be good. There's a lot of new advances with medical stuff and interventions, and
Yeah.
so yeah,
Good things.
well, we're doing good. We're doing good.
And we've all got each other, which is
got
even
each
better.
other.
So
Exactly.
that's what helps me
We
get
got
through
each
things
other, even
anyway.
if we gotta give
Having a
each other.
community, and
Yes.
definitely.
Yes.
Definitely.
Even if we gotta give virtual hugs.
Oh yeah.
I'll do the. How did you do that clap thing?
Go to reactions on the bottom there, or there's in your menu. That's what we get.
Oh, I see.
Yep, there you go.
You can have a party thing. Did that work?
Oh, there you go. That's cool.
Awesome.
I should be a little bit more versed with this Zoom thing, because that's what we've been doing. Has been, because of the coronavirus, has been back to Zoom. So, and then after Elias is done this weekend, he goes back to school. So it's been interesting, to say the least. Yeah.
Well, let's stop here. We'll close out here, and then we can talk about possibly
And come
another
back for part 3.
Part 3. We'll do that, and then we can think about some of the questions that we need to answer. So we'll close it out. Larry, you want to close us out?
Yes. Thank you for talking about this again. And like I said, we'll come back for part 3. And what I think maybe we could do, if anyone watching wants to, is ask some questions. We could post this in the Facebook group and that, and see if anyone's got any questions they want to ask for the next video about tracks and track care and anything to do with this. And yeah, I think that'd be a good way moving forwards, and maybe getting some more information out there from people who are watching these videos.
Love it.
I agree.
Yeah.
All
So
right.
until next time, guys, we'll see you next week.
All
Thank
right.
you.
Bye, guys.